Hi, my name is Christy, and today I'll be performing the hand exam with my partner, Steve. Steve, do I have your permission to perform the hand exam?
Yes.
Great. So first I'm going to perform some hand hygiene. Okay, so my exam is going to start just the way all exams should start. So it's going to start with inspection, move on to palpation, and then manipulation. So first I'm just going to generally look at his hand. So I'm inspecting for any scars, any swellings, any muscle wasting, any deformities. And I'm also going to take a look at his nails, which can tell me a lot about his general health. So I can see if there's any Terry's nails, any Bow's nails, um, any clubbing, or even any cyanosis. So this is helpful because right now his nails are his fingers are on a white backdrop. If I didn't have this in a clinical setting, I could always put his hands on a white coat, and I could use that to assess for cyanosis. So right now I'm seeing a totally normal exam. So I'm going to move on to having you flip your hands over. Great. Let me flip both hands over, Steve. Thank you. And I'm going to assess for temperature. So I'm going to assess above the wrist. That's kind of hard to see. Above the wrist and below the wrist. So when I'm feeling in his palm, I'm not just assessing for temperature. I'm also assessing for any moisture. So A, that could tell me maybe he's nervous about this exam, or B, he could have something more serious like thyrotoxicosis. So his skin is a normal temperature and his hands are dry. So that's essentially normal. So then I can also move on to palpating his arteries. And I feel a strong pulse there that feels normal as well. And I can do that on the other side. And I feel that strong as well. So then I can also assess the thenar and hypothenar bulk. So I'm just going to feel this here and here. And then I can also see if he has any palmar thickening across the center of his palm. And that would make me suspicious of Dupuytren's contracture if he did have some palmar thickening, which he does not. So next I'm going to move on to some joint palpation. So Steve, I'm going to have you flip your hand palm down. And I'm just going to lift up your hand and I'm just going to apply some pressure here. Any pain when I do that?
No.
Great. So then I'm going to move on to palpating actually each joint in the hand. So I'm going to start off with the metacarpophalange, or essentially the knuckles. And you just tell me if you feel any tenderness when I do this. Okay. Now I'm going to feel the proximal interphalangeal joint. Great. And then the distal interphalangeal joint. Great. No tenderness?
No.
Great. I'm going to move on to the thumb here. So I'm going to start off here at the carpometacarpal joint. Any tenderness?
No.
Okay. I'm going to move on to the metacarpophalangeal joint. No?
No.
Okay. And then the interphalangeal joint. No.
No.
I can also then assess while his hand is like this, I can assess his anatomical snuff box. So I can have his hand flex like this, thumb out. So it's right there. Any pain when I assess there?
No.
Okay. So if he had pain when I assess there, that would make me suspicious of a possible scaphoid fracture. So next I'm going to move on to flexion and extension. So I'm going to have you flip your hands over like this. I'm going to have you make a fist and open. Make a fist, tight fist, and open. Do that for me a few times. Great. That looks really good. You can go ahead and stop, Steve. Thank you. So what I'm looking for here is just general movement of his hand and structure as well. So I can see if there's any deformities like the ape or claw hand, or even hypermobility of the joints. I can also assess for boutonnieres or swan neck deformities of rheumatoid arthritis. And then I'm going to go on to finger extension against resistance. So I'm going to have you lift your hand up off the pillow. And I'm going to apply downward pressure. Don't let me push your hand to the pillow, okay? How does that feel?
Okay.
Feels okay? Great. So next I'm going to have you spread your fingers wide. Don't let me push them together. Great. So that's normal strength. So that's really great. So next, Steve, I'm going to assess your grip. So I'm going to have you grab my fingers as hard as you can and give me a great squeeze. Wonderful. So that was a really normal grip strength. So essentially this was a normal exam. So I'm assessing the muscles, the tendons, the joints, the connective tissue in his skin. So I'm able to assess all this stuff in a really quick exam. And that also tells me about his general state of health as well. So this was a normal exam. Steve, do you have any questions?
No.
No? Okay. Well, thank you so much. I'm going to perform some hand hygiene, and that's the hand exam. Thank you.